you for joining us. The This webinar is about our new funding award, the Public and Community Partnership Award. Today, we're going to give you a little bit of background to how the award was developed, and then we're going to give a little bit more detail on the aims, eligibility, and the selection criteria. And I'm really pleased to say we're joined by Lula and Paige, who have been our local authority research practitioner colleagues who have piloted the scheme starting September. They're going to give you some top tips for applying and what they've learnt so far. Going to finish off with some timeline and some resources and contact details for us for after. We'll not keep you longer than the hour, and we want to try and leave enough time to answer any questions as well after. I should have said, sorry, I'm Kasia Krowska. I'm the Public and Community Partnership Manager for the NIHR Specialist Centre for Public Health. Just very quickly, for those that aren't aware of us, we are funded by the National Institute of Health and Social Care Research, and we are jointly hosted with Newcastle University and partners and the University of Southampton and partners. Our specific part of the specialist centre is delivered by Newcastle University and partners, and we have 3 satellites across the country, one in Yorkshire and Humber, the Midlands and the South West, and we cover the whole of England, and we support local authorities across England and researchers doing public health research outside of the NHS. And then just briefly as well, for those that aren't aware, we have 4 pillars of work at the centre, and underneath all of those pillars is our public community partnership work and our research inclusion work. And today, I'm not going to go into lots of detail on the pillars. We'll give a link to our intranet so you can find out more, or we're always happy to meet with people and discuss all of the work that we're doing, the support we can offer. But today we're talking specifically about the local authority support and resources pillar and this new fund that we have established in that pillar. So a little bit of background to how the award was developed. The first thing I'll do is just go over a little bit of the words and the descriptions we use. So we use the word public and community partnerships as the centre to describe how local authorities involve and engage people and communities in public health research. This was a term that was jointly agreed with our public contributor board, which includes a diverse representation of public contributors from across England and the local authority, every region of England. And we chose that term because we wanted it to be very much describe how research happens outside of the NHS. Health research is happening outside of the NHS setting, so not using the word patient, but we do follow the NIHR definitions of involvement engagement, and they are detailed below in those boxes. So really just focusing on this award primarily is focusing on involvement, and the NIHR described that as research being carried out with or by the public rather than to, about, or for them. And it's about trying to create active partnerships with public and community and researchers, and that's what this award is trying to bolster in local authorities with their community and resident populations. We recognise that there are lots of different names and descriptions and approaches to involvement, and local authorities all use different terms, and some of those are described on this slide. But really at the heart of it is the research cycle, and when it comes to involvement, we often talk about getting researchers, getting local authorities to think about how they can involve people and communities right through this research process. We do have a webinar that is recorded on our website around demystifying public and community involvement. I'd really recommend anyone who's new to the ideas or the NIHR's kind of definition of involvement to have a look, have a watch of that. But also, if you come to one of our one-to-one advices, we can really talk you through that and give you some more support. And we also just we also have been looking at the public and community involvement frameworks that are out there. Here are some lovely, colourful versions of examples that we found, and we've been thinking about some of these frameworks and how the PCP award can respond to some of the ambitions that are in these frameworks. what we did at the start of this year is we created a co-creation group for the award, and they met in April and May, and it was a really broad diversity of people. We had 29 people on the group, and they were from across England. There was a lot of local authority reps, and some of you might have been on that on our co-creation group. If you're here today, thank you very much for your time. We had community organisation represented, also public or resident voice. We had our satellites, and we also included NHR infrastructure colleagues from different regional groups who've done awards or who have experience around involvement, and also our NHR colleagues in the Central Commissioning Facility. And what that group did was advise us on the potential of how we develop the PCP award, how we develop the mechanics of it. So how much should we be offering? What should be the aims and objectives? How should we evaluate it? How will we know that the award has made a difference? And we asked them a range of questions that helped kind of to shape the awards that we've now launched. And we also went through a process of looking at those colourful frameworks, of which I've shown you three of them, but there were others as well that we kind of really picked apart as a group and looked at what worked, what didn't, what was the reality of how local authorities experience working with their communities to involve them in public health research. And as part of that, we were hoping we'd have a framework at the end of it, but it was far too difficult at that point to kind of come up with that. So what we decided was to set 7 public and community partnership principles that would guide this award and that we would test during that. And these are the 7 principles. They're very high level. They're a little bit wafty. We do have a web page where we've tried to go into a little more detail of what we mean by what the co-creation group meant by these different principles, and trying to give some examples of what would that actually look like in a community setting or a local authority setting if you were achieving some of those principles. So as part of the application form, applicants are asked to pick at least one of these principles that they will commit to trying and evaluating as part and looking at how they realise that principle in the work and their project that they're planning. I'm going to go on to the aims, eligibility and selection criteria for it. So the aims of this award, I'm very, very excited about this award, and I'm really excited about what it may achieve. The award is to explore new or improved ways that local authorities can involve people and communities in their public health research that's conducted outside the NHS. And the aim is to try and increase voice and representation of diverse people and communities in public health research in localities. And the award, we hope, will generate evidence, insights that can be shared with other local authorities, can be shared with other community organisations, and hopefully strengthen our understanding of how public and community involvement happens public health research setting across England. And we hope to, as part of that work, understand if there is the opportunity for a framework or a new way to illustrate that everyone can support and use as a bit of a guiding tool. We're offering £10,000, and that can be used over a 12 to 18 month period. The award is the contribution towards salary costs, project activity costs. It can include public contributor costs. For those that have looked at the application form, one of the things the co-creation group were really keen we did was make sure that there was a space in there to cost out accessibility costs as well, whether it's interpreters, childcare costs, other things that might be barriers for people getting involved in their public health research. The funding, the project has to be able to start by June next year, by 30th of June next year. And the award, we would really encourage, if you've chosen a partner, to really share the resources as well. And we'll be, expecting to see the equity of the resources being shared with any partners that you have. The projects must be led by a local authority in England. Unfortunately, HDRCs are not eligible to receive the funding, but can be listed as a supporting partner. So an HDRC, and for those that aren't not aware, they're health determinant research collaboratives, and there are around 27, I think, in England. Someone can probably correct me on that. I think there are 30 in total, but there are a couple in the devolved nations. And but they can be a supporting partner, and we'd really encourage wherever possible HDRCs and other local authorities to work together. HDRCs are obviously much further along the path of involving people, so have a lot of learning that maybe could be shared across a locality. You can have up to 2 partner organisations named in the bid, and those partners don't need to be a registered charity. Where that was one of the things in our pilot we realised we didn't want to disadvantage the small grassroots organisations who maybe haven't got a registered number. So 2 partners are allowed to be included. It must be a project focused on public health research. And I've already had some kind of questions around what do you mean by public health research? And we use the NIHR's kind of description of public health. And I think my lovely colleague Ellie's going to put a link in to the website where NIHR explains this. And it is very much around the kind of population health, health research done outside the NHS, and around the wider determinants of health and health inequalities. And we can talk, anyone who comes to one of our one-to-one advice sessions, we can really talk through and make sure that projects would be eligible. Really importantly, local authority must have a mechanism to share the funds with any project partners outlined in the cost breakdown. We know being able to pay other partners can be tricky sometimes. So we're making sure that everyone thinks about how you would actually, how your finance setup works to make sure you can pay people and partners for their time and their input and involvement. And all projects must take place in England. Here are some very rough examples of kinds of projects that we're looking to hear from. It is not an exhaustive list. I think one, and I'll let you read it, some things to pick out. We know there are a number of our, as a centre, we funded local authority research practitioners roles in local authorities across the country, and we know for some local authorities in this kind of involvement approach is quite new, so the funding can be used to explore involvement options and engage and have start conversations with your local partners to think about how to do that and to come up with a model that works for you. And so building on that, it can be new partnerships with the voluntary community or social enterprise sector. And that also includes infrastructure organisations, so local infrastructure organisations, LEOs, that also exist for the VCSE sector in different areas. We are really keen as well if there are innovative ideas around how local authorities want to think about their own workforce, their own services, and where they have contact with residents, and they want to look at involving them in more in public health research, how a project could develop new ways that a local authority wants to find people in their services and in their kind of in their asset base. And it can also be used to kind of look at working with people in communities around setting public health research priorities. So thinking about the whole public health kind of agenda of a local authority and doing some priority setting. We know there are many health determinant research collaborators who've done some fantastic work on that. So there may be partnering opportunities there as well. We are happy for the projects to be targeting particular underrepresented groups in public health research, and I think you'll hear from Lula and Paige how they're doing that in their own proposals. But like I say, this is not an exhaustive list. Just want to, sometimes it's easier to give you examples of what isn't eligible than what is eligible. So I just wanted to, in the conversations we've had so far with colleagues, we wanted to just put a couple of things in to help you think through your proposal. So the first one here is, in an eligible project would be a project that's going to do pre-award involvement work for a specific single research project. We have a pre-award public involvement fund that you can access through our research design award service in our pillar, one of our pillars, and that. So this is, we're really looking not to duplicate this. So proposals to be eligible, we need to show that even if they're looking at a particular group or a particular topic, how that is going to lead to the, and their proposal needs to show how it will lead to the wider impact and influence of residents and communities in the public health research of a local authority as an organisation. We're not looking to deliver single projects that don't connect into the wider infrastructure of and systems of a local authority. And the the projects do need to demonstrate that especially around the sustainability question in the application form. And once again, we've got some advice sessions so we can really help with thinking that through. There's some amazing local authority community engagement functions already existing across the country, but an eligible project can't fund an engagement team in a local authority alone. It needs to use, but you can use existing residents and communities and connect in with your public health work and show how you're going to use existing networks you have to focus in on giving them opportunities to help shape new ways of involving them. And I think Lula's is a really good example of that when she comes to talk. And using the funding to evaluate a project or service a local authority's delivered wouldn't be eligible. But using an existing project or service to start a conversation with residents to get them involved in public health research and get them trained as community researchers, or to start a conversation of how an approach could work of involving them in your locality would be. And there's a really good example. One of the examples we've had is a local authority asked us, could they apply for the funding for their warm welcome initiative, and they wanted to evaluate the service, and they wanted to use the funding to have focus groups with people accessing the warm spaces initiative, and get their views on how it's gone. Now that really is a service evaluation of an initiative at local authority. What would have been eligible was if they were using the Warm Homes initiative to go and start to upskill the people who use that and engage them and involve them and give them a voice in how public health, the whole public health agenda around war homes develops in their area, and where the public health research outcomes can be developed, with them being an active partner in thinking that through. Selection criteria, very quickly. There are 4 areas that our panel will be scoring against, and they are detailed here. I'm not going to go into lots of detail about this, only to kind of we'll be looking to make sure that the project is going to make a difference, that it isn't falling into the trap of some of those ineligible projects that I've just kind of tried to explain a little more about. We want to know what the challenges or barriers have been for the people you're wanting to get involved in the research, and how you're going to overcome them as well, so we can have some learning from how we involve a greater diversity of people in public health research in different localities. It needs to be realistic as well, and make sure that the timescales are realistic. One of the things the co-creation group talked about a lot was how long public involvement can take in building trust, building activities. It's not done very quickly. So that's why we stretched the project from 12 to 18 months. So thinking through in the outcomes how you can make sure that you're not overstretching what you can do will be really important. And once again, our one-to-one advice sessions can really help you with that. And we will be thinking, there is a question on sustainability of the partnership. We recognise that funding is incredibly tight, but there are lots of ways that, and we've seen in lots of ways where local authorities have invested some money and some resource in empowering people to be part of their public health research, where that can lead to a journey for them to be involved in the wider work of the local authority as well. So we'll be looking for not just monetary examples of where you can sustain it, but what are the skills, the knowledge and experience that either staff or your communities have learned, and where might that take you in the future as a partnership for your research. Very quick mention on the evaluation impact. We want to keep the evaluation very light touch, and we're kind of saying that there will be about 2 to 3 days maximum of project time where someone in the team will be part of reporting back to us. There will be a template, a reporting template that we will send to our awardees. We're going to try and keep it as light touch as possible. We'll be working with Lula and Paige to draft that and make sure that they guide us on that it is light touch. Having been an income generation manager before in charities, I know what it's like when you're having to do reels and reels of reporting for smaller amounts of money. So we will be very mindful of that and your time. We do hope to do some in-depth interviews and case studies from the different projects funded across the country, and we're really hoping to set up a learning event at the end of the award as well, and probably towards the end of the award, to bring everyone together to celebrate what's been achieved, and also to look at what the learning has been, We are also hoping we're going to be piloting some ripple effect mapping training, and the awardees will be one of the key priority groups to make sure that you are able to attend that, in case ripple effect mapping is an area of expertise that you would like to develop for you evaluating your involvement. So over to our LARPs, Paige and Lula, to give some example, so give you a little bit more information about what they're doing with the fund that the PCP fund they've been awarded, and any of your top tips and things to keep in mind. So I think it is it's Paige first, if you're okay.
Brilliant, thank you. Hi everyone, my name's Paige and I'm the LARP from Kent County Council. We were approached a few months ago by Kasia and the team to see if we'd like to pilot the PCP award. Obviously we jumped at the idea. We've got lots of partnerships that we're really keen on developing. So I'll give you a quick overview of what our project is and then some tips when it comes to applying for the fund. Our project's called From Recovery to Research, and it's a peer-led public health initiative. We're working in partnership with Reach Out and Recover, or RAW, as I'll probably refer to it throughout this presentation, who are a lived experience recovery organisation supporting people who have experience with addiction. Something we were really mindful to consider is feedback we've heard from regional patient and public involvement groups, which is these small pots of funding are time limited, and when they come along, communities are engaged, and then when the funding finishes, the projects dry up and they are dropped. So this is something we spoke in detail when we were designing and supporting the development of this award. So sustainability was our main focus, and to be honest, the only thing that as a council we went into discussions with our partners with and said this is really important to us. So we listened to our community partners and developed it from there. We're looking also to ensure that the commissioning cycle is something that we considered as well. So when commissioning cycles come round, the service is no longer engaged necessarily directly with KCC, that we are leaving a legacy of public health research with these services. What we decided on was a train the trainer method. We are hoping to support this organisation to have a sustainable model to continue to be involved in public health research throughout their journey with us and then onwards. We are going to co-design a modular training programme and eventually have peer research champions who will learn to support the people that they work with to engage and understand public health research. We're hoping that empowering their clients to contribute to co-creation and the delivery of research projects ensures that future research is shaped by the voices of those who are most effective. Something that came up during our scoping conversations was specific projects, which Kasia has just spoken about and are obviously ineligible. Something that's really important, obviously, is evaluating the impact of all the services. So that was something they'd said. We really want to learn how to evaluate the impact that we have on the communities that we are serving. So we've weaved that into our project. And although it's not a single project around evaluating the impact, they will learn the skills throughout to evaluate their services, but then also apply them skills elsewhere so that the impact we have is lasting and can be applied across a wide range of research areas. So by embedding the research engagement skills into these trusted community-facing roles, the project creates a sustainable model that can continue beyond this initial funding period. We're hoping to build long-term capacity by establishing a network of peer research champions who will continue to support engagement activities, contribute to research governance, and act as a bridge between communities and researchers. Lastly, we're ensuring that we address the principles that were discussed right at the very beginning of this webinar. So being inclusive, we're ensuring that we are supporting diverse communities, sharing power, learning and resources. We've ensured that it's a large proportion of the funding is going to the partner organisation itself to support us in developing this programme, and that it's been a true co-design process. So we went in really, really open-minded. As I said, the only thing that was really important to us was that sustainability. And we are also ensuring that we identify impact, and we're doing that by ensuring we embed the evaluation from the outset, ensuring we work with RAW to identify what meaningful change means to them and what impact from this means to them. And we are embedding that from the very beginning and evaluating throughout. Onto some tips for applying. Absolutely make the most of the supportive application process. Kasia is brilliant, always open to non-judgmental conversations. Don't worry that you're going to be marked down if you come with an idea that's ineligible or anything like that. I came with a few different project ideas and Kasia was like, no, absolutely not. We could tweak this one. This one's brilliant. Absolutely. So just really helpful chatting things through with Kasia. And I promise you, it's non-judgmental. She's very, very open and will discuss any ideas with you. Next is don't let the fear stop you from applying. If you and your council are at the beginning of your journey, don't let that stop you. As Kasia said, this fund can be used to start those conversations, do some scoping, build the partnerships. And you never know, there might be funding in the future that you can build on that with, but don't let that fear stop you. Even if your projects don't necessarily work, it's still learning and it's still useful, and you can still then go, we tried this, it doesn't work. Don't waste your time on trying. Be flexible and open-minded. As I said, we went in with sustainability being the top of our agenda, and other than that, we were guided by our partner organisation. Although we might have an idea of what will work in the council, it's really important that we're hearing the voices of those that we're hoping to engage. And at the end of the day, they are the experts when it comes to their communities and what will work for them. So ensure you are making sure that you're open-minded and flexible. Lastly, share far and wide the opportunity. You might find some potential partnerships that you weren't aware of, or ones that you were aware of but needed that time and space to level up. These opportunities often start the ball rolling. So it might not be the right time now for certain projects, but it will give you time to tick along in the background and develop something for future potential opportunities. So that's my top tips. My contact details are there if you'd like to discuss the project or the application process. Thank you. I'll pass on to Lula, I believe.
Thank you, Paige. Yes, I will just get that, and thank you for sharing, and thank you for making that important point. Just to clarify, myself and Ellie are doing the advice sessions. Ellie's on the call. We're not part of the decision-making panel, so we can be, yeah. So it's a very non-judgmental. We're really looking forward to the chats that we have with you all. Lula.
Yeah, I'm gonna just kind of, really follow up from what Paige said and from what you've just said, because really having the chat with you is the super helpful way to really work on those ideas. So Paige mentioned that, do not be afraid if you're very early in the development of research. For me, my local authority is at the launch stage of our research readiness. And whilst we have pockets of some really, really good practice, I think we still are learning and thinking about new ways in which we can do it better. I think for what we have chosen for our award, Kasia started mentioning, we are continuing working with a group that we've worked with before, but we're exploring new ways in which they can actually be in the leading capacity for the types of research that we engage on with them. And actually they have become a great catalyst for also our connection with other partners on research relating to public health and wider public health. So one of the things that, for example, my group in one of our districts was interested in was physical activity that would be the right kind of physical activity for their particular group. And we started reaching out to other partners who are also interested in doing research on that. So that's really been a beautiful kind of, journey of discovery and co-creation, and them really being in the leading seat. And that's fine because you can write that into the application. So the application is really open to this. You can kind of say, well, we're thinking about doing these things, but actually we might test and learn, and test and learn is one of the principles that we've decided we're going to try. So it is an award that has got that built into it. What we also looked at, and the principle that we've decided to test, was varied and meaningful involvement. The group of women that we're working with are all mums. They're also principal carers for sometimes elderly relatives. So they've got busy lives. So it's also around making sure that what they are able to do is recognized, and that still they can see the impact of what they have done, they have said. So there is a form of kind of, action research inspired activity that we're really doing there. We've got an academic partner, a university partner as well, in a supportive capacity there. So that's something that I think someone asked in the chat about. And yes, you can have a university partner, but you don't have to. And that's the interesting part of it. I think for just applying for the award, what's really important is understand the principles. They are really important, but they also really open up the idea of what this award is. And if you've ever looked at co-designing, co-creating research with communities, they will really speak to you. Do book that one-to-one or one-to-two. If you're developing that idea with someone else, we actually booked a one-to-two. We had a session with Kasia, with myself and my colleague Haj, who was absolutely crucial in developing that idea. So it was really good with us two in the room, kind of, saying what our ideas are, what our experiences have been so far, to kind of really start thinking about what we're doing here. I would say also from a local authority perspective, look for synergies with your local strategic plans and an overall direction. Stronger communities is a very important theme for Lancashire County Council. And so that was one which we thought really beautifully aligned the PCP award, with what my council wants to achieve. So there's obviously going to be a buy-in for what you're trying to do when you say, this is part of our strategic orientation. And as I said, start seeking out partners. So not just you and your community group, but also others around you. Once you start talking about the plan to apply for the award, and then you've applied and you're kind of, waiting and everything, beautiful conversations can also emerge from that, and you will start finding people willing to come on that journey and develop with you. For us, our project is the Community Research Catalyst. So we've taken our group from participants to our community research partners. As I said, we've selected test and learn and varied and meaningful involvement. But we also identified further PCP principles, those that allow the group to identify impact, but also us to identify our impact, share power, learning and resources. And that was really important as well. As I've mentioned, we've connected to our strategy, so building stronger communities, and we've got further local partners. So we started looking at partners who could come on that journey with us. And so around the project, we've got quite a lot of people who want to see it succeed. And I think that's also important. You're typically thinking about something rather small, but you want it to grow. And as Kasia mentioned, ripple effect kind of mapping is a very important way of thinking about doing that type of ABCD work. So yeah, that's it. I'm also freshly out of a meeting just yesterday with the group, so really buzzing with excitement for things to come as we get further into the work.
Great. Thank you so much for sharing, Lula. Thank you to you and Paige for being so flexible in being part of that pilot, because we came to you very and some other potential sites at in the summer when everyone was about to go on their holidays. So thank you for making the opportunity happen. We're nearly at the end of the slides, and then we can cover questions. The funding timeline. So it opened on Monday, the 29th of September. It will close on the 5th of December at 5 p.m. We have tried, you would not believe how many times we have moved these dates and tried to leave as much time as possible for you to apply, knowing the experience Paige and Lula had and the kinds of colleagues internally and externally you have to kind of get conversations with and get agreements from. So we really hope that it leaves you guys enough time to apply. The panel will meet on the 9th of February. And the panel will be made up of public contributors, VCSE, national organisations, and also some local authority colleagues will be working with centre staff to go through and decide the applications. We really hope to be able to give you the decisions by the 20th of February. And as we've said before, we hope that the projects can't start any later than the 30th of June. We have, and hopefully my colleagues will have put in the chat as well, there is the one-to-one advice sessions. If those dates don't work, then please get in touch with us and we will try and find another time to meet with you. For those that are new to this whole area of involvement, we recommend looking at the demystifying webinar that we ran a couple of months ago. We also have a fantastic range of resources that Ellie on this call has coordinated and pulled together, working with local authorities and community and public contributors, and that's the PCP resources, and there's a link there. It includes kind of thinking through budgets. It's got templates for role descriptions and ways of working agreements, and there's a lot of resources there, so would encourage you to have a look at that. Thank you for listening. I'm going to end the slideshow now, and I suppose firstly check if anyone wants to ask any questions in the group, or we can go to the chat. Has anyone got any comments or suggestions or questions they'd want to ask? That's fine if you don't. Ellie, I wonder, have you been, because I haven't had my screen on, are there some key questions?
Yes. The first question, Kasia, is from Rachel. Just clarifying, this funding is for local authorities to apply for, and they in turn look for local partners?
Yes, yeah, that is correct. Because the centre has been set up primarily to support local authorities, and because we've done a lot of contracting with and Brady on the call has done so much work contracting, we thought that was the easiest way to make sure it's a smooth process when the awardees get going. But we will be looking to see where the proposal is, including partners, that there is equity in how the budget is shared.
Great. The next question is from Laura, and this was touched on briefly, but are we able to bring in a university partner with expertise to collaborate? She's thinking of a particular person with expertise in the area she's interested in.
Lovely. Yes, university partners are, as Lula said, they are very much welcomed, but they're not. This is primarily for the local authority and the communities that they represent, that they're working with, to try and resource them. We'd hope university partners are involved where you want to be, but you wouldn't be marked down if they weren't. And we're just really keen that the resources do go to the local authority and the voluntary community partners as much as possible.
I've got a few questions from Monica. What's the top funding figure we can apply for?
It's £10,000. And that is per local authority. So we're not accepting multiple applications from a local authority, just to be clear. We'd really hope, because these awards are to support local authority in its systems, its processes, its infrastructure, involve people in its public health work and public health research work, we wouldn't be funding multiple projects across a local authority. I hope, does that answer it?
And then the second question from Monica is, basically, can we enhance an existing project by increasing the reach and involvement of community researchers?
Yes, you can, as long as it's focused on public health research. Yes, that would be fine, as long as it has that focus. And I'd just advise you to come and have a chat as well, as much as possible. There is a box in the application where we ask you if you've had a chat with us. That's really just to encourage. We want a supportive process and we want people to be successful. So come and have a chat and explore that a little bit with myself or Ellie as well, maybe.
The next question is, are we allowed to involve more than one partner?
Yes. So there is, oh no, I'm going to test my memory of the application form. I feel like all I ever did was look at this for weeks on end. You can have a local authority, another local authority partner named in there, and you can also have a public contributor or community organisation named in there as a contributor. And then there's space for two VC or two partner organisations to cost their budgets in there. We limited it to partners in costing because £10,000 really doesn't go that far once you probably start doing that. So we just wanted to limit the reality of what's possible. But if anyone has like a project that like they want to involve multiple people and then there's something with the application form that's really stopping you do that, then also, once again, broken record, come and have a chat with us, and we'd be really welcome to hearing if that there's something unique that you're planning that stops that's get limited by those two partners.
Great. And then there's a question about the timescales for applying for the funding.
Yeah, is that so? It is open now, and you can apply today if you'd like, and submit. But the deadline will be 5 p.m. on the 5th of December. I don't know. Was there something else in that? Whoever asked it, was there something more specific about the funding timeline?
It was from Monica. Monica, I don't know if you want to add anything.
Sorry.
No, I realised that after I've posted the question that you actually published it in the slide deck, so it all answers my question. Thank you.
Great.
There are a couple of questions about the slides and recording, so just to confirm, we're going to be sharing both of those. So Emily's asking, can local authorities that have a DRC like ours apply, or would we need a community organisation to apply?
So an HDRC local authority cannot apply for this, but they can be a named partner. We can't financially, for this award, HDRCs can't receive the finances of this award, but they can be a mentor, a coach, a supporting partner to another local authority. But yes, unfortunately, the HDRCs are not eligible on this occasion.
And someone's asking, what roles do Paige and Lula work in? Are they public health, research, other?
I'm going to let them answer that.
Would you like me to go first, Lula? We both work as LARPs, so local authority research practitioners. I do have a dual role, so I also work as the research portfolio lead in the council as well. Lula, did you want to add anything?
No, I've put the same in the chat, and I've added the fact that you've got this dual role as well, which is slightly different. I'm a LARP only.
We could maybe put a link, Laura or Ellie, into our intranet page about LARPs and that specific role and that funding, so that people can see more information about that. Any other questions?
Yes, so there's a question from Olivia. Can it be a project that carries out some public health research with an underserved community and then learns from that experience to enable sustained involvement? Or is it just looking at the mechanism to involve?
It can be both those things, really. I think what we're hoping to achieve with this award is that in different localities, people try different approaches that work for their local authority and their communities, and there can be joint learning from that. I think we probably just want to talk to you in more detail about that and make sure that that the project that you were looking at had eligibility. It is okay to kind of focus in on a particular group to engage them, but in the sustainability question, you really need to be showing how you link into the wider strategies of the council, or as Lula and Paige have said, where the skills and learning of staff or that group will have a wider impact on public health work in the local authority.
Great. Monica asks, what if more than one application is submitted from the same local authority? Will you consider them, although I appreciate no more than one can be funded?
That's a really good question, Monica. We might have to come back to you on that. We hope that there will be enough joint conversations in a local authority where that won't happen, especially if you're having to talk to any finance team to cost out staffing salary. Hopefully it will be picked up if there were multiple organisations. multiple places in a local authority doing that. I think we would probably, we have built in a lot of time, if you've noticed, between December and February. So we would probably come back to that local authority to say you have put in multiple and have a conversation with you. They wouldn't just, we've tried to build in a lot of time to ask questions and check eligibility before the February panel so that we can be really clear. But ideally it should just be one.
Great. There's another question on that, but I think that's been answered. And then Mark asks, what are the topics that are classified as public health issues that qualify for the funding?
Oh, that's a really good question. I hope she's got Louise. Would you, as our research design senior lead, I'm not sure, Louise Hayes, would you be able to just give us a little bit of a description of the public health focus?
In terms of what we will classify as non-NHS public health, you mean? Can you hear me, Kasia?
Yeah, I can. Yeah. Ellie, is that the question? Sorry.
Yes. What are the topics that are classified as public health issues that qualify for the funding?
So we would consider anything that's in the broadest sense can impact on the health. So thinking about the wider determinants of health. So what we're not interested in is anything that the NHS does, which is public health related, but anything that you might do outside of the NHS in your local authority, and that might include working across directorates, say with people in planning or transport or housing or all the other areas that local authority works that influences health. Does that help?
Hopefully, and thanks, Louise. I'm glad you were on the call just to be. And once again, a broken record, come and talk to us. We'll double check all those kind of things for you and to try and make sure. Anything else, Sally?
Yes. So Chloe asks, how much research experience do you need?
Not much, actually. Probably we're looking more for it's the intent really to involve people in the public health research, and if you're at the early stages of that and there's that you're developing, that is okay. We really hope to be able to offer the awardees all the training and make sure all the resources that the centre is putting together and working with other NHR colleagues to put together to hopefully help you along the way. You don't have to have everything sewn up to apply for this, but there has to be, you have to have some role responsibility. The people who are going to do this project have to be able to then see it through and see its effect have impact across in their local authority for their public health research. I hope that's fine. Hope that's helpful.
Just slightly linked to that, Kasia. So can any role within public health who's responsible in some way for research be the named applicant, or does it have to be the LA's LARP equivalent only? It
doesn't have to be, but I'd be really hoping that the LARPs or we haven't mentioned them, but the public health engagement leads, that they were connected in, if there is one, that they are connected in, and that there was going to be some coordination there, only because we know these are key roles that are being funded to help create a research culture in a local authority. But if you're a local authority who doesn't have a LARP, doesn't have a FEL, we're still really keen to hear from you and just describe how you're going to use this fund to kickstart that involvement in your research. There's a question that asks in the application, what's your research pipeline, or what's the research projects that you're doing as a local authority, so we can understand to see where they'll have an impact in the application form. I hope that's helpful.
There's a question, how many grants will be awarded?
Oh, good question. There is a budget envelope, but it's a generous one. So I don't have a definitive number. This is a brand new award for us. It's also an award that the centre has developed since it was funded through that co-creation group. So we are keen to hear from, and we're not sure how many applications we're going to get, but we will look at every application we get, check eligibility, and try and support as many to be funded as possible.
Okay, 2 more questions in the chat. So Chloe asks, with regards to the NHS question, in East Yorkshire, we have a homeless hub situated within the community. However, it's part funded by the VCSE, LA and the ICB. would the NHS's involvement prevent us from using this setting for our research?
I think, Chloe, it would be worth us having a chat. It depends on what you say, what your proposal is, and how it's going to impact in a local authority, in your local authority, and with your public health agenda in the local authority, and how that can connect in. We can't fund NHS-based activity, but I'd love to just have a chat with you in more detail and find out where and look at where it could be eligible or not.
Great. And then the question, is it a rolling grant programme?
No, it's not on this occasion. It is a one-off, and that is primarily because we are looking to get learning, and when we as a centre have a contract that will end in 2028, I believe. So we need to be able to have the projects delivered and have some evidence of the impact before the end of that. So we're very unlikely to run this award again just because of the life of the centre as it currently is funded.
Great, and just one more question. Just clarifying, if I heard right, did Kasia say that if your local authority is not listed on the LARP, the local authority can still apply? Yes,
definitely. We just want to be really clear in your proposal how it was going to kickstart involvement in your research, your public health research agenda in your local authority. But we'd love to hear from you as well, and wherever possible, maybe link you with a LARP that's maybe a neighbouring local authority or a FEL as well, or an HDRC, and where we can get you any support as well. Because everyone is on a journey with this as well. We don't have no one has all the answers because it's about your local area. So we will try and help wherever possible. But yeah, you don't need to be a LARP. You don't have to have a LARP to apply.
Great. Val is just checking. Did you say only one app from the local authority, one application?
Yeah. There will only be one application, but if we do receive multiple, we'll look at that, and we will go back to the local authority and the people that have applied to look at which one they would prioritise.
Great. And Mark's just checking, can someone who doesn't work in the local authority apply in partnership with the local authority? Yes,
but it has to be the local authority on the application form. The local authority has to lead the application with those partners involved. And that's really just because of the way we are set up as a centre and our contracting and our primary aim is with working with non-NHS settings and local authorities. So yes, they have to be the lead partner, but that doesn't mean that so it's a flip of that, Mark. But come along with your local authority partner if you want, and let's have a chat about it.
Great. I think that's all the questions. Actually, I really hope I haven't missed any. There are quite a few. Please put your hand up if we have missed one.
Or if not, we can give you 7 minutes back of your day, which I'm sure everyone can appreciate. It's an open door. Come and talk to myself, Ellie. We've got the email address there. Thank you for your time today. Thank you to Lula and Paige for sharing so generously with their experiences. Thank you to Ellie and Laura Lewis, who are making sure that everything works, IT, and making sure we cover the questions. And thanks, Louise, for me putting you on the spot and and answering that question as well. Have a lovely day, everyone, and we really look forward to hearing from as many of you as possible.